As you know, we've put the worst of COVID behind us, but the effects and the fear continue to linger. Have we learned any lessons? And could another virus cripple our country? Are there some safeguards now in place that weren't before? Those questions received some intense scrutiny by a group of medical professionals known as epidemiologists. It's a big word for a big job. They study the structure of threats to public health and how to combat them. Well, one of our country's top epidemiologists is with us tonight. He was a guiding hand during the COVID outbreak, appointed by then President and soon to be President once again, Donald Trump. He was director of the Centers for Disease Control and Prevention. You remember him as Dr. Robert Redfield. You may recognize him from all those briefings when we got the terrible understanding of just how rampant COVID was. Dr. Robert Redfield, I want to say thanks for joining us. With my voice sounding like it is, chances are maybe the reason I wanted you on is because I would say, is there a doctor in the house? And I'm glad there is one. Welcome to the show.
Well, thank you, Governor. Thank you very much. It's a pleasure to be with you.
Let's hope this conversation is going to be a little more comfortable than some of those high-pressure press briefings that you had to endure in the early days of COVID. It was an unusual time in America. We did things I never thought would happen. We basically shut down the country. In retrospect, was that the right course? Is that what we should have done?
No, Governor, I think there really was a lot of government overreach. I think your state actually showed a much more measured response compared to many of the states. I was more in the Mike Pence camp, where I felt that we should take a knee and maybe for 10 to 15 days and reevaluate certain activities and then determine how we should modify them so we could continue to do them in a safe and responsible way. But I was not an advocate of shutdowns. One of the greatest mistakes that was made by many, and again, your state was exceptional in this regard, was closing schools. We never should have closed schools. I tried to teach as CDC Director that I thought the public health harm to kids K through 12 by closing schools was substantial. They were much more to their public health advantage to stay in school. And we're paying that price, as you know, today in many of the states where these kids have really been knocked off their learning curve. So, and same with our economy. I think it was a huge mistake. The other major mistake that was made that was carried on in the Biden administration was mandating vaccines. These vaccines should have never been mandated. People should have never lost their livelihood because they chose not to get this vaccine. So there was a lot of government overreach. So when you ask me about lessons learned, I think one of the most important lessons there was to really avoid government overreach. And I think it was extremely unfortunate the way what was meant to be a 10 to 15 day pause turned into a year or more of shutting down activities, which was not in the public health interest of this country.
Until 1972, America was on the gold standard. And what that meant was that all of our dollars were actually backed up by physical gold. We changed that. And as a result, gold actually became worth a great deal more because it means that it's going to hold value even when the dollar, due to inflation, begins to shrink. It's one of the reasons that owning physical gold and silver makes a whole lot of sense for people who want to protect their wealth, who want to protect the things that they've worked so hard for their entire lives. Well, if you're going to buy gold and silver, I recommend you buy it from American Hartford Gold. It's who guides me on buying gold and silver. They're the only precious metals company that I would recommend. Now, you can call or text and request a free, no-strings-attached gold and silver information kit from American Hartford Gold. Learn how to protect your nest egg with a tax-advantaged gold IRA. And you could get up to $15,000 worth of free silver on qualifying purchases. So call them at 844-417-1010 or text Mike to 998899 for a free information kit from American Hartford Gold. Dr. Redfield, your point, both then and now, was dramatically different from that of Dr. Anthony Fauci, who seemed to be a big proponent of the complete shutdown, mandated vaccines, mandated masks. I remember him at first saying, oh, no, we shouldn't wear masks. Only professionals know how to wear a mask. Wearing a mask is very dangerous. A few weeks later, no, we got to wear a mask. And a few months after that, you ought to wear 2 or 3 different masks. And it got to where, and I think this is one of the real most damaging things about what happened in COVID. It wasn't just that the disease was very harmful and took people. Friends of mine died from it, so I know it's real. But I think one of the bigger things that happened was that so many of us lost faith in the public health community. And we need faith in the public health community, just like we need faith in the justice system. So how did Dr. Fauci become, I guess, such a almost unchallenged oracle for the procedures, the practices, and what we did?
Yeah, it's very unfortunate. I remember the first White House briefing. President Trump talked, and then Vice President Pence talked, and then Ambassador Birx, who worked for me for many years, talked, and then I talked, and then Tony Fauci talked. And when Tony Fauci got up after me, he said, I first want to tell the American public that I'm the leading public health voice in this nation. And I kind of went to him afterwards. I said, when you run a laboratory, I'm the Center for Disease Director. I mean, my role is to be the voice for this public health response. Tony definitely assumed it. And unfortunately, Secretary Azar didn't change that assumption. And he rapidly, basically was on the media 6 in the morning to 12 midnight at night, trying to become the voice of the epidemic. And as you noted, unfortunately, he made a lot of mistakes. I hope someday he'll be honest and admit them, because he was the strong advocate. And he was in the meeting with the president, along with Ambassador Birx and Vice President Pence and Chief of Staff, where they had the meeting where they decided to do the shutdown. I was excluded, wasn't in that meeting. I was not an advocate for shutdown. As it either was really, for the truth, either was Vice President Pence. He really wanted to have what he called, he used a sports analogy, let's all take a knee for, a week or two, and then let's get back to business. So, but Fauci definitely assumed that role. And, having been head of NIAID and controlling most of the money that was invested in biomedical research for 3.5 decades, his voice, the media just, took his voice as Bible, and a lot of mistakes were made. I think a lot of public harm was done. And you said the most, and I noticed your show called Trusted. Trusted. It's one of the most important challenges we have right now, because public health agencies like CDC have lost public trust. And in public health, if you lose public trust, you can't impact public health. And rebuilding that public trust is going to be a real challenge for the new Trump administration to really go about trying to rebuild it. When I used to speak as CDC Director, the people that are there would always remind me, be very careful about making a mistake in what I said, because it took us decades to get the public to trust us. And it could be a day and you could lose that trust. And I do agree that, unfortunately, we've lost a lot of public trust.
Personal safety has become a major concern. So wouldn't it be helpful to have a new and easy way to protect you and your loved ones? Well, one way to stop the threat without having to shoot and possibly kill someone is available. Hello, I'm Mike Huckabee, and I found exactly how to have full protection without lethal force. It looks like a gun, acts like a gun, but it shoots chemical irritants and kinetic rounds, not actual bullets. The name is Byrna, B-Y-R-N-A. Now imagine being able to protect yourself without the legal or moral concerns of carrying an actual firearm. The Byrna is legal in all 50 states. No background checks are required, and it can be shipped directly to your doorstep. Most importantly, it's built to immediately stop an attacker without taking a life. The peace of mind you have is free. It's easy to use and doesn't have the strong recoil that real guns have, and you don't need ear protection either. It's assembled by hand right here in the U.S., fully trusted by law enforcement, and oftentimes it only needs to be shown and not fired to turn an attacker away. Don't wait until something happens. Go to Byrna.com/Huckabee and learn more about this effective alternative to deadly force. 500,000 are out there already, and right now you'll get a special 10% discount too. That's Byrna with a Y, Byrna.com/Huckabee. and don't feel vulnerable any longer.